All right, let's talk about what you need to know. Hello, everyone. Welcome to another episode of the MDI Prep INBDE podcast. We are here to actually share topics with you that have appeared on the exam. As always, remember, these brief podcasts are just to introduce what appears on the exam and not intended to replace an actual study program. For a complete live online course, you can visit MDI Prep Online at www.mdipreponline or call 1-888-827-9881. All right. Today, our guest is Dr. SP, who will be sharing a very important topic that has appeared on the INBDE exam. So everyone, I want you to welcome Dr. SP to the MDI Prep podcast. Welcome, Dr. SP.
Hey, thanks for having me.
All right. So I don't want to waste any of your time. I want to get right into it. So go ahead and let's share.
Yeah, so today we'll be talking about a few patient management encounters we could experience and kind of how to tackle them. So starting off, something that you may or may not see covered on this exam would be patients that have a history of opioid abuse. So let's say that you have, for example, a 40-year-old patient coming into your office and they need a tooth extracted, but they mention or disclose to you that they do have a history of opioid abuse. And so there are some things that they may ask you, what should you consider first before rendering treatment for something like this? And so the important thing to know is that patients that do have a history of opioid abuse can actually present with certain unique challenges when it comes to pain control because their threshold may be higher than normal. And so these patients tend to have actually a lower pain tolerance. And so this makes it difficult to control pain post-procedure. And so this may cause them to actually quickly relapse into their previous drug habits. And so the first thing that should be done for any patient who has a history of opioid abuse is first to determine the patient's current level of pain and then come up with a way to manage it after the appointment is done. So generally for us as dentists, we're going to use our go-to combination of analgesics being NSAIDs as well as Tylenol following an extraction to relieve pain. And so if this isn't sufficient, then as the dentist, we have an obligation to assist our patients with pain control. And so in those cases, we can actually add other drugs to the regimen, even if the patient has a history of drug use after checking the opioid control index. And then another problem we could possibly encounter is a patient coming into your office and for whatever reason, let's say they smell of alcohol or they appear to be under the influence of certain medications or certain drugs, And what should we do then? So if a patient comes to your office in pain, but let's say they smell of alcohol indicating that they're inebriated, then the best course of action is to first figure out how the patient actually got to your office. We do not want to render any treatment to a patient in this state, primarily because when they're under the influence, they can't legally consent to any treatment. And this includes any prescriptions, especially with controlled substances, that could be given to them to assuage those symptoms. And we do want to dismiss these patients after we figure out how they got to the office, because let's say you dismiss a patient immediately who presents in an inebriated state. We don't know how they're going to get home. Are they driving themselves? Or did someone drive them? If they drove themselves and you simply escorted them out of your office and they ended up on the road while inebriated and caused an accident, it could be traced back to us as the clinician. So we should be able to identify whether or not a patient is inebriated, for example, and then be able to arrange a safe transport for them home out of the office and not render care until they're in a more alert-oriented and aware state of mind to make independent decisions for their treatment. And kind of one other thing that I wanted to touch on last is with pediatric patients. So, for example, let's say we have a 6-year-old child presenting with autism, and it's important to know with these kids some appropriate behavior management techniques. And so in the pediatric population, patient behavior management is really important because kids can show high levels of anxiety and be a little bit more uncooperative in the chair, both either before and during treatment. In patients with autism, some really effective techniques that we can use would be distraction technique. So distracting the patient from the uncomfortable procedure that's going on to manage their special needs. The tell, show, do method is another popular technique that's going to be employed by clinicians. So basically what we're going to do first is we're going to tell the young patient about the procedure using age-appropriate terms and a calm voice so that they are able to understand to the best of their ability what we're trying to convey to them, as well as showing a little short demo of what the procedure would look and feel like, maybe even allowing them to hold the hand mirror and feel it and take a look. And then finally, after we gain a little bit of trust and see a willingness to cooperate, performing the procedure. And so that's another great management technique for pediatric patients, especially those that have special needs. And then lastly would be modeling. And so in this technique, we're actually alleviating the stress and anxiety in these patients using comprehensible models to promote understanding and demonstrate how the procedure will be performed. And the end goal of this is going to be to reduce the fear of our young patients. And it's really helpful as well when working with patients that do have autism. A common way that the board exam likes to trick us with pediatric patient management questions is with the hand-over-mouth technique. And so this is typically used to gain control of an uncontrolled child by having the dentist place their hand over the child's mouth while telling the child that the hand will be removed once they're a little bit more cooperative and less disruptive. In this case, though, generally this is going to be a little bit overkill and a little bit traumatic to our patients. So we do want to avoid the hand-over-mouth technique nowadays as much as possible, because it can actually exacerbate those feelings of anxiety as well as the feelings of uneasiness in our patients. And so those are the 3 patient management topics that I wanted to cover today for you guys in a little bit more detail, just because they may or may not be appearing on your INBDE exam.
So let me ask you this, Doctor. So do they give that as an answer choice? The hand over mouth is like one of the answer choices?
Yeah, so they like to throw that in there, and they'll ask it as an exception question generally. And so that would be the obvious exception, just because of how traumatic and exacerbating it is to the already inherent anxiety in these patients.
Oh, I see. And in terms of patient management questions, if you had to guess percentage-wise, on the INBDE, what percentage of the test do you think are patient management type questions?
Yeah, so with the integrated exam, since it's a little bit more blending, it's a little bit more holistic of an exam, there's actually a fairly significant amount of patient management questions that you can encounter. Granted, it does vary from person to person and exam to exam. And so I'd say a rough percentage would be maybe around 10 to 15 out of the 500 questions that are on the exam.
Wow, that's a significant number.
Yeah, and they also like to blend the patient management in with some ethics, and so that's always a little bit more of a way that they're integrating the exam. Okay.
And just to touch back on when you talked about the inebriated patient, so in terms of those types of questions, are those mainly accept questions, or are they pretty much just straightforward?
Pretty straightforward. Kind of, you have a patient in a certain state of mind, and then what would be the next step is generally the exact wording they'd use. So what would be the next step to handle such a patient or such an encounter?
Gotcha. And so the general rule of thumb, if you kind of had to sum that up, the general rule of thumb is to what? If you have that kind of patient, what's the general rule of thumb?
I'd say the main protocol to follow is figure out how they got to your office.
Okay.
Because we want to figure out how we're going to get them back home safely, and then dismiss the patients. We can also have them be sat in the lobby if that is an option on the exam as well, in the multiple choices, and have them watched over until someone is also able to come get them. But we don't want to render any care because they're not going to be able to be in a good state of mind to legally provide consent for anything.
Awesome. Well, Dr. SP, we appreciate you joining us today on the MDI Prep podcast for the INBDE. And as always, we love what you're sharing. We've gotten a lot of great feedback from your previous podcast, and we look forward to seeing you or hear from you again.
Great. Yeah, I look forward to being back.
All right. Well, have a great day.
You as well. Thanks for having me.
All right. Bye-bye. Well, once again, another wonderful podcast where today we talked about patient management. And remember, if this recording is something you like, if you like our podcast, please do us a favor. Hit the subscribe button, share it with your friends, hit the like button so we can add more of these podcasts to keep you up to date on what's next on the INBDE. We have a new class starting very soon. So if you want to join that live online INBDE class, go to www.mdiprep.online or visit us at call us at 1-888-827-9881. Until next time, remember, you got this and you'll do just fine.